Britain's National Health Service is one of the best in the world. When international experts studied global healthcare systems, the NHS scored top marks for efficiency, effectiveness, and putting patients first. At Optimum Medical, we're playing our part in this healthcare system that handles 1 million patients every 36 hours.
They have very high standards in the products that they select and they choose for their healthcare system. So for us to be able to sell to the NHS, we're very proud to be able to be one of their main suppliers for healthcare lubricating gel.
One of those gels, Optilube, is a market leader, exported to 60 countries. In the UK, it's sold to 90% of NHS hospitals, where it's used in a whole range of departments, including urology, gynecology, anaesthetics, accident and emergency, and endoscopy.
All types of endoscopic procedures, from the upper GI tract to lower GI tract.
Endotracheal tubes, laryngeal-mask airways.
We're doing rectal examinations on male and female patients.
Performing speculum or vaginal examinations.
With a flexible cystoscope and insertion of catheters.
Nasopharyngeal temperature probes.
If we were performing proctoscopy or rigid sigmoidoscopy, we would always use gel on those devices.
Hysteroscopies and theatres as well.
Each year, over 17 million patients attend accident and emergency departments across the UK. Those with the most serious life-threatening injuries are raced there by air ambulance helicopter.
We and the air ambulance are kind of held back and targeted towards the more seriously injured people. They include people trapped in road accidents, falls from height, stabbings, shootings, people who are seriously injured who need advanced intervention.
So we'll just swap that for the LMA just to maintain him a bit better.
Lubrication is very important. These are patients who are critically ill, who need an airway intervention as quickly and as safely as possible. Putting equipment in that doesn't have lubrication raises the chance of the equipment not going into the right place in the right time, and if it does go into the right place, it may not sit correctly. So effectively, we need to be able to put those devices in a smooth manner with as little complication as possible, and Lube allows us to do that.
Tube goes in.
Tube is past the cord, so bougie out, please.
Away.
There's always a risk when we're putting a device into somebody's mouth or into their throat that we can cause trauma, and Lube, in effect, does help minimise that risk.
Set up for an RSI.
Yep, we're all ready.
Studies have revealed that patients who need this level of life-saving treatment are in greater danger of getting infections later in their care. So using sterile gel, such as Optilube, is particularly important for clinicians working on air ambulances and in A&E.
The patients that we're using the gel on for an airway procedure are critically ill. Quite often we find these patients have infections that develop over the course of the next few days, and anything we can do to minimise that risk of introducing infection is of course of paramount importance.
Sterility is also vitally important in urology. A fifth of all infections acquired in UK hospitals involve the urinary tract, and 80% of those are linked to urinary catheters.
A urinary tract infection is always a possibility after a urological procedure, but they can be very disabling for the patient. In the elderly population, they can cause confusion and lead to admission to hospital. So we are always very interested in decreasing the incidence of infection.
Urinary tract infections cost the NHS £124 million a year. That's over £1,100 per patient. So sterile, single-use formats of Optilube not only protect patients, they save hospitals money too. James Cook University Hospital is one of the largest hospitals in the northeast of England, caring for over 1 million patients a year. Many visit its purpose-built endoscopy centre. Here, Dr. John Greenaway is one of 5 senior gastroenterologists. He sees Optilube water-based lubricant gel as essential for patient comfort and safety.
In the UK, for a number of decades now, its use has been ingrained in practice. And almost anything that we do that involves insertion of either a finger or an endoscope into any orifice involves the application of lubricant gel. And the reason for that is just that it makes the procedure so much more comfortable for the patient. And we'll then now be able to insert that into the gentleman's anal canal. The dangers of not using any lubricant, in addition to just it being more uncomfortable for the patient, is that you can cause local trauma. So to the anal canal, making very easy progress. He's been an absolutely brilliant patient and doing very well in terms of being comfortable throughout the procedure.
Patient comfort is also one of the key reasons Optilube is so popular in gynecology and obstetrics, where clinicians use it for the majority of procedures and examinations.
Any vaginal examination or speculum examination can be quite uncomfortable for the patient. The tissue down there can be very delicate, for example at the vaginal entrance, so you'd want to insert the speculum as gently as possible, and the lubrication helps the speculum go in without causing any micro trauma to the tissues there. I would say that this is particularly more pertinent in those older ladies, particularly postmenopausal, when the tissues are very, very delicate there, and just even with the best will, you can cause micro trauma and bleeding.
Optilube's pocket-sized single-use tubes and sachets are very convenient for clinicians too.
They're actually quite handy to carry around. So, for example, part of my role, I often visit other wards, other theatres, so I always keep a few sachets in my pocket because not every other ward stocks them. So they're very handy for me.
Leeds Teaching Hospitals is one of the biggest and oldest NHS trusts in the UK. It has an international reputation for medical training and cares for over 2 million patients at its 7 hospitals every year.
Here's something that's going to make you a little lightheaded.
At St James's Hospital in Leeds, Dr. David Duthie is a senior anaesthetist. His key role is putting patients to sleep before surgery. It's a skillful procedure involving numerous pieces of equipment. Optilube lubricating gel makes the process easier.
I use lubricating jelly to aid the passage of these various bits of equipment into their correct position. It makes passing endotracheal tubes more straightforward, but when you're using 2 bits of plastic equipment rubbing against each other, it's almost essential to use lubrication in order to put the equipment into the correct place. So, fibre optic bronchoscope goes down the tracheal lumen of the endotracheal tube, and when it comes to the curve within the pharynx, it won't pass any further. So if I take it out, lubricate it along its length with some gel, and try again. Round the corner and where I want to be. And not only is it help me positioning the equipment, but it also causes less pain and discomfort to the patients. There's less bleeding from the mucous membranes, and the patients are more comfortable after their operation. I'm using water-soluble gels because I want them either to be absorbed or removed from the patient and not left as a crust on the bits of equipment that I use. I would rather not use oil-based solutions. These can be left in the patient or cause damage to the plastic and equipment and the coatings of the bits of equipment that I use. Yep, that's fine.
The main reason why Optilube is very popular and is sold to over 90% of hospitals in the UK is because we've developed a formulation that has the right viscosity and the right characteristics to be able to be used in many, many different departments. So we've listened to the customers from the different departments and we've developed a gel which is suitable for their needs.
This refinement based on feedback has made Optilube particularly popular in hospital urology departments, ideal for a whole range of urological procedures.
The gel needs to be clear so that it doesn't obscure the view through the urological instruments. You can see it's nice and viscous and it adheres well. Once it's on, you just wipe it around so that you get good lubrication for ease of insertion. if it's too watery, it will just run off the instrument and it won't stay to create that layer between the instrument and the urethral lining.
Supplying to the NHS means all Optimum Medical's products have to meet the highest clinical and quality standards.
It's really important that we as an organisation have the ISO 9001, we also have the ISO 13485, and we're fully CE certified for all the products that we promote and sell into the healthcare sector. We test in-house, and we have 2 labs that do the testing in the UK, and we test lots of different characteristics of the lubricating gel. For example, we would test the viscosity, we'd test the pH, we'd also test the sterility of the lubricating gel to make sure that it meets the specification and the standard which is required to sell the products into healthcare sectors around the world.
The success of Optilube is by no means restricted to the NHS. In the UK, it's also sold to a large number of private healthcare companies and private hospitals, as well as GP surgeries, care homes and pharmacies. It's proving increasingly popular on the international market too. Optimum Medical's busy warehouse in Yorkshire already ships out large quantities of Optilube to over 60 countries around the world. And now it's pushing into new markets, including some where health professionals know very little about the use and benefits of lubricating gels.
We're really keen to be able to provide training and education packages that are bespoke for the different markets that we're working in, and it's something that we're investing a lot of money and a lot of time to ensure that clinicians, not just in the UK, but clinicians internationally, know exactly how to use our products and also the benefits of using sterile lubricating gel.